Hi everyone, welcome to AETCM, the Emergency Medicine channel. Myself Haritha. Today we are going to see how can we dilute and administer injection adrenaline, also known as injection epinephrine. As we all know, injection epinephrine plays a vital role in emergency medicine departments. Epinephrine, it is a medication as well as a hormone. As a medication, it is used to treat a number of emergencies includes bronchial asthma, anaphylaxis, cardiac arrest and so on. Inhaled epinephrine can be used in pediatric age groups to treat or to improve croup, which is a respiratory disorder. So what is the mechanism of action of adrenaline? Actually, it has both alpha and beta effects. It acts on both alpha and beta agonists. So in low dose, it acts as a beta effect, that is vasodilatation, and in high dose, it acts as an alpha effect, which is the most strongest, that is vasoconstriction. What are the routes of an administration of this injection adrenaline? We can give it as intravenous, that is IV, IM, that is intramuscular, subcutaneous, endotracheal administration, and so on. So what are the route of administration of injection epinephrine? We can give it as intravenously, that is IV, intramuscular, that is IM, subcutaneously, infusions, endotracheal administration and as well as nebulizations. So what is the concentration that we can give all these drugs? Let us see the examples. I will now demonstrate how can we load and to dilute for the desired concentration of injection epinephrine. So let's see how can we dilute according to our desired dosage. So what you are seeing is the adrenaline ampule. This is a 1 ml ampule. Each 1 ml of this solution contains 1 mg of adrenaline. So it is a clear, colorless, sterile aqueous solution intended for parenteral administration. You can see it's a colorless liquid. Now how it is supplied? This is a 1:1000 dilution ampule. Okay. In vials, it is containing 1 ml, 1 mg. Each ml will be 1 milligram. So, how can you make it as a 1:10,000 dilution, which is indicated in cardiac arrest? You can mix it with, you can load 1 ml of injection adrenaline and rest you can mix it with 9 ml of NS to make it as a 1:10,000 dilution. EpiPens are also available. But in case of EpiPens, that is an auto injector, the dilution will be different. That is 1:2000 will be the dilution. The dose will be 0.5 mg per ml. So most frequently indicated indications are cardiac arrest, anaphylactic shock. Now let's see how can we make it as a 1:10,000 dilution. Now I am loading 1 ml of injection adrenaline from this ampule. As you can see, now I have diluted with rest of 9 ml NS to make it a 1:10,000 dilution. So this is 1:1000 dilution and this is 1:10,000 dilution. In cardiac arrest, you can give this 1:10,000 dilution every 3 to 5 minutes, or you can give 1:1000 dilution followed by 10 ml NS flush. So next indication is a bronchial asthma. In acute severe unresponsive to beta agonist, you can give adrenaline as a nebulization. So what is or how you can give adrenaline as a nebulization? In adult patients, just load 0.3 to 0.5 ml from this 1:1000 dilution in a 1 cc syringe, then mix it with 3 to 5 ml NS and then you can give it as a nebulization. So you can load 0.3 ml from this ampule . Okay, this is 0.3 ml that I have loaded from this ampule. Make it or dilute it with 3 to 5 ml NS, and then you can give it as a nebulization. In pediatrics, the dose will be 0.01 mg per kg. So next indication is anaphylaxis. In anaphylaxis, the dose is 0.3 to 0.5 ml 1:1000 dilution, deep IM. Most preferable site is the lateral aspect of the thigh. You can give it as subcutaneous also. The dose of pediatric age groups is 0.01 mg per kg. So I have taken 3 ml. You can see 3 ml. You can give this as a deep IM. Next indication will be bradycardia. In bradycardia, adrenaline can be given as infusions. In adult, take 4 similar ampules of adrenaline, dilute with 46 ml of NS to make it a 50 ml solution for infusion. The dose will be 2 to 10 microgram per minute. In pediatric dose, 0.01 mg per kg. In pediatrics, repeat it every 3 to 5 minutes. So, let us now conclude the class. I hope this was a valuable information for the day. And you have not yet subscribed our channel, please do subscribe our channel.